Throughout this procedure, be sure to have an experienced person stabilize the head and restrain the animal. After applying topical anesthetic, use sterile cotton-tipped applicators to remove the redundant epithelium, using radial strokes to facilitate the process. Once a cotton-tipped applicator is moist, it may no longer have enough traction on loose epithelium, so use a new dry, sterile cotton-tipped applicator. Continue debridement until all loose epithelial edges are removed. Normal, healthy epithelium is tightly adhered to the stroma, so it will not be removed by cotton-tipped applicator. Often you will end with a larger erosion than indicated with the initial fluorescence staining. After debridement, reapplication of topical anesthetic may be beneficial before this step. Clamp a 27-gauge needle to a hemostat so that the tip of the needle is barely exposed. Here, a commercially available anterior stroma puncture needle is being used. After parting the eyelids and stabilizing or resting your hand over the patient's orbital rim, begin to make punctures 0.5 to 1 millimeter apart across the erosion and extending 1 millimeter beyond into normal cornea. Make sure that the needle does not come in contact with the eyelids or third eyelid. If this occurs, discard the needle and begin with the new one to avoid the risk of seeding bacteria into the micropunctures being made. Since it is often difficult to access defects behind the third eyelid, to facilitate treating this area, use a cotton-tipped applicator to move the third eyelid away or flex the patient's head downward so the eye rolls up. These ulcers are usually not infected and therefore only require broad-spectrum antibiotic eye drops every 8 to 12 hours to prevent secondary bacterial infection.